Definitely some issues there worthy of concern. Now, joining us on the line is Deputy General Secretary of the Ghana Medical Association, Dr. Titus Beyuo. Dr. Beyuo, thanks for joining us. What do you make of the announcement that Dr. Emmanuel Tinkwine just made?
Good afternoon, Daniel, and good afternoon to your viewers. Unfortunately, I didn't hear all part of the speech. I heard a latter bit of it saying that the face mask use is mandatory and is the only way, and the fact that the facilities, they don't have any proper facilities for management. I don't know if there was more to it that I missed.
Well, he began by saying basically that almost all the isolation centers in Kumasi are full, and very soon they will struggle to get space for COVID-19 patients in the Ashanti region. That's the footing on which he started. What's your reaction to that, Dr. Beyuo?
So, well, that is a statement of fact coming from him, and I would accept that fact. I, however, would disagree with him that the only solution we have is the use of face masks. I think this management of this pandemic is multi-pronged, but gradually, if you listen to the communication from officialdom, it's like managers of our healthcare system, government, are really, for want of a better word, shedding their responsibility and adding it to the individual. There is a role to be played by government and by management. If the treatment centers are full, of what use is face mask alone? The face mask, yes, is useful to us, but we must take concrete measures as to what we are going to do to expand the capacity. And if we cannot expand the capacity, then we should take a national decision to reverse some of the easing of restrictions that we have done. Being mindful that we are in a state where now the managers of our healthcare system are saying that the facilities are full. This is perhaps one of the first admissions we are hearing directly from a director or for a manager of the healthcare system admitting that the facilities are full. When the media raise these things, often what we hear are defense coming in from the managers and directors that there is capacity. But if they are admitting that it is full, then it is high time they advise government and take more concrete decisions at our levels of protection. The levels of protection of the community has a governmental level, we have the community level, and we have the individual level. We are now hammering on only the individual level, which is that everybody should wear face masks, use the preventive etiquette, and all of that. Even when we all practice that, some people will still get it, and those people will need to be managed. So what is government doing about that? Secondly, in terms of the restrictions, if we have come to the point that we know that now our facilities are getting choked, we should all come out.
Dr. Beyuo?
Yes.
Yes. So I just want to get this quick reaction from you on another point that was made. Dr. Tinkwine again revealed that 97 healthcare personnel in the Ashanti region, particularly doctors and nurses, have contracted COVID-19. One person has died, unfortunately. Being a doctor yourself, what do you make of this?
It is sad. We expected that we will bear the worst brunt of this disease, we doctors and nurses and healthcare workers in general. In fact, from our data, the largest number of doctors affected so far appear to be coming from the Ashanti region. Unfortunately, majority of these are our younger colleagues, the house officers, the junior doctors, first year house officers, second year house officers, the medical officers. And we need to look at what protection are we giving to this group. So it is an unfortunate event. We expected it, but I don't know. It means that we have to up our game in terms of the protection of our health workforce.
You mentioned that most of the people who are dying are the younger medical population, and these are the ones who come in direct contact with the patients. Does that mean that they are not getting enough PPEs, Dr. Beyuo?
Well, the information we are picking from our members is that the PPEs aren't enough. We've had issues about even the type of PPEs that are made available. And also, if you look at the statistics we have, that definition of frontline needs to be looked at, because most of the attention and distribution of PPE and everything has gone to as treatment centers and isolation centers. Majority of these doctors and nurses who are affected are ordinary doctors working in ordinary healthcare facilities that will manage a case, and before they realize the case is positive, and their level of protection is very poor. So we have issues with PPEs, we have issues with delays in testing, and that is another major block that is leading to the infection of several healthcare workers. Because if one person is suspected and we take the sample and it takes a long time, sometimes by the time the report comes, the person is dead. You can imagine the number of people who get infected.
Wow. Dr. Titus Beyuo, thank you so much for joining us this afternoon. He's Deputy General Secretary of the Ghana Medical Association.